Have you ever found yourself wondering why things in the bedroom don't quite feel the way they used to? Maybe you've noticed it's taking a little longer to get going, or the results just aren't as consistent. You're not alone. As we get older, especially past 60, our bodies start to change in ways that catch us off guard. And for many men, that change shows up right where confidence and intimacy meet. Let's be honest, nobody wants to talk about it, but every man thinks about it. And the truth is, struggling with erections, performance, or desire doesn't mean you're broken, and it certainly doesn't mean your best days are behind you. In fact, understanding what's happening and making just a few smart changes can help you feel stronger, more energized, and more confident, not just in the bedroom, but in every part of your life. In this video, we're going to talk about something that most doctors either rush through or completely avoid: the real, natural causes behind weaker erections in older men. And more importantly, we're going to cover what you can do about it, without gimmicks, dangerous pills, or pretending like it's just part of getting old. Because it's not just about sex. It's about blood flow, energy, hormones, and quality of life. When your circulation and your body are working well, everything feels better. Now, let's start with the first root cause, which is probably the most overlooked: poor blood flow. Your erection, at its core, is all about healthy circulation. When you're young, your blood vessels are flexible and wide open. Blood flows freely and responds quickly. But as we age, those vessels can stiffen, narrow, or even get partially blocked by plaque. It's the same reason your doctor might worry about your heart or your blood pressure, because what's happening down there is often a reflection of what's happening up here. When blood flow slows down or gets restricted, your erections naturally become weaker or slower to respond. You might still feel desire, but the body doesn't quite cooperate the same way. Now here's the good news: blood vessels can be supported, even rebuilt to some degree, with the right choices. Walking just 20 to 30 minutes a day, even at a slow pace, encourages fresh blood to circulate throughout your body, including to the penis. Adding heart-healthy foods like leafy greens, berries, beets, and even a little bit of dark chocolate can help relax and nourish your arteries. And it's not just food. If you've been sitting for long periods every day, watching TV, driving, or at the computer, it's cutting off circulation to your lower body. That puts extra pressure on the pelvic area and slows everything down. Stand up every hour. Stretch. Move your legs. Even rotating your hips while you're brushing your teeth can help loosen up that area and keep blood flowing. Now, let's talk about another big contributor that sneaks up on many men: diabetes. Whether it's diagnosed or not, elevated blood sugar damages the tiny blood vessels and nerves that are crucial for healthy sexual function. And unfortunately, men over 60 are at a higher risk for insulin resistance or type 2 diabetes, even if they're not overweight. You might not feel any pain or obvious symptoms, but if your blood sugar stays high, it quietly chips away at your body's ability to perform. The problem is, diabetes doesn't just affect your energy or your feet. It targets the smallest blood vessels first, like the ones that supply the penis. Over time, this can make erections not only harder to achieve, but harder to maintain. If you've noticed that sensation or sensitivity has gone down, that could be a warning sign. The best part is, even small adjustments can bring blood sugar levels back into a healthy range. Drinking more water, cutting back on refined sugar and white bread, and getting better sleep can have a fast and powerful effect. And don't think you have to go on a strict diet or become a health nut. Sometimes, simply swapping soda for sparkling water, or replacing a nighttime dessert with fruit can make a real difference over time. It's not about being perfect, it's about giving your body the support it needs to do what it's naturally designed to do. Now, let's look at something that often gets ignored completely: medications. If you're over 60, there's a good chance you're taking one or more prescriptions, maybe for blood pressure, cholesterol, or anxiety. And while those medications may be necessary, many of them have a quiet side effect: they interfere with sexual function. Blood pressure meds, especially beta blockers and diuretics, can slow the very system that powers your erection. Antidepressants and even some antihistamines can reduce libido or numb your response. The tough part is, most men don't make the connection. They just assume they're losing interest or that their body's slowing down. But in reality, the medication may be playing a much bigger role than you realize. This doesn't mean you should stop taking your meds, never do that without your doctor's guidance. But it's worth having an honest conversation. Ask if there's a version with fewer sexual side effects, or if you can make lifestyle improvements. To reduce your need for the medication in the first place, the key here is being proactive. You are not stuck with the hand you've been dealt. There's always something you can adjust, and there's nothing wrong with speaking up for your health, even if it's a little uncomfortable. Your well-being and confidence are worth it. Now that we've touched on circulation, blood sugar, and medications, there's another layer that's just as important: how your daily habits can either help or hurt your ability to perform. Let's keep the conversation going, because what we're going to talk about next might surprise you. It's something that affects millions of older men, but rarely gets the attention it deserves. Welcome back. If you're over 60, I want to speak to you about something many men notice, but rarely talk about. I'm talking about subtle signs your penis may be struggling long before full-blown problems arise. These are not just signs of aging, but red flags your body is waving to get your attention. Let's start with the small changes. Do you wake up without morning erections anymore? Or are your erections not as firm as they used to be? These aren't just age playing tricks. This can be the earliest sign of reduced blood flow to the penis. Green circle what that means: if blood isn't getting there, that means oxygen isn't either. Without proper oxygen, your penile tissue slowly starts to weaken, shrink, and lose elasticity. Over time, even nerve signals fade. Left untreated, this can result in permanent erectile dysfunction. One of the worst lies society tells senior men is, erectile dysfunction is normal. Just live with it. That is absolutely false. Light bulb real truth? ED is common, but not normal. It often points to deeper health issues like poor circulation, early diabetes, low testosterone, or heart disease, and guess what? Your penis is often the first place to show those issues, even before chest pain or high blood sugar. So when ED starts, it's not just a bedroom issue, it's a body-wide alert. A lot of men think ED is just about the body. But your mind plays a huge role. Anxiety, depression, stress, they interfere with the signals between your brain and penis. This is why so many men get frustrated when nothing is wrong physically, but they still struggle. Man health worker. What I tell my patients: it's okay to seek mental health support. You're not broken. You're human. And your penis deserves a healthy body and a healthy mind. This may surprise you, but your penis works like a muscle. The less you use it, the weaker it gets. Chart decreasing: men who don't have regular erections, even if they don't have a partner, are more likely to lose penile length, stiffness, and function. Brain pro tip: even spontaneous arousal, gentle stimulation, or nocturnal erections help maintain penile health. Think of it as exercise for your manhood. When a senior male patient comes to me with ED, these are my non-negotiable tests I always order first: blood pressure and cholesterol panel, HbA1c, diabetes marker, testosterone levels, free, and total, Doppler ultrasound of the penis, if blood flow is suspected, prostate screening, if urination is involved. Woman health worker: this isn't just about erections. It's about your life. Because in many cases, the penis is the first thing to go quiet, before your heart sends its next warning. Listen, you deserve to feel whole, confident, and healthy at every age. Don't suffer in silence. These changes are not shameful. They're signals. And signals are meant to guide, not to frighten. Gentlemen, I want you to ask yourself something very seriously. Are you ignoring this one habit that may be silently damaging your manhood every single day? Let's talk about blood flow, the lifeline of your penis. You see, after 60, many men notice their erections are weaker, or that they fade quickly. Some blame it on age, some on stress. But what they often don't realize is this: when blood vessels are clogged, due to high cholesterol, diabetes, lack of exercise, or even smoking, the flow to your lower region decreases. This not only causes weaker erections but can also lead to long-term nerve damage. Point 1. Start a 15-minute walking habit. Brisk walking improves cardiovascular health, reduces inflammation, and increases blood flow to the groin. Even 15 minutes a day can create noticeable changes in your performance and stamina. 2. Eat nitrate-rich foods. Foods like beets, pomegranates, and leafy greens boost nitric oxide in the body, which expands blood vessels and promotes better erections. Add beetroot juice or a spinach smoothie to your breakfast. Your body, and your partner, will thank you. 3. Quit smoking and limit alcohol. Smoking hardens your arteries. Alcohol numbs nerve endings. Combine both and you've got a recipe for disaster. Try limiting alcohol to 2 drinks per week and quit smoking for good. You'll see changes in your skin, energy, and sexual vitality. 4. Try simple pelvic exercises, Kegels. Yes, men can do Kegels too. These strengthen the pelvic floor, improving control and performance. Try this: squeeze the muscles you'd use to stop urine midstream, hold for 5 seconds, and release. Do this 10 times, 2 to 3 times a day. Men, long hours of sitting, especially on hard chairs, compress the blood vessels and nerves leading to your penis. If you sit a lot during the day, take breaks every 30 to 40 minutes. Stand up. Move your hips. Stretch your legs. Your lower region needs oxygen, and that only happens when you get the blood flowing. In my clinic, I've seen men who regained full function just by fixing their blood flow. It's that powerful, and best of all, these changes don't require expensive pills. Just a few small habits, done daily, can give you results you thought were lost forever. In the next part, I'll show you the shocking truth about soaps, lotions, and grooming tools that are secretly harming your penis, skin, and nerve sensitivity. You do not want to miss it.